Now, after discussing the etiology, incidence, and pathophysiology of babesiosis, and we now know that the most common species causing the babesiosis is the Babesia microti, although we have some other species also, but very, very rarely they can cause infection. About 50 or so cases usually are reported. And it's a protozoan parasite, tick-borne infection that can cause this infection, and it mainly affects the red blood cells, cause lysis of the red blood cell. So moving to the next section now, we will discuss in this mainly we have what are the different manifestations of babesiosis and how the babesiosis present itself. It can be asymptomatic, and as I mentioned in the first section, because the symptoms are not specific, that causes the underestimation or diagnosis of babesiosis. Although the incidence of babesiosis increases about 5-fold in the last decade. So that's one reason, and that's where we will discuss asymptomatic Babesia microti infection, because symptoms are not present, so it's misdiagnosed. Then we will talk about some mild to moderate cases, and then severe infection, and then other Babesia infections besides Babesia microti, how they can present themselves. So asymptomatic Babesia microti infection, asymptomatic, no symptoms are present. At least 20% of adults and 40% of the children do not experience symptoms, and you can see it's a big number. Although in the young we already know the disease is not very serious, mild cases are present in the youngs, and they are also asymptomatic also. So 20% of the adults, 40% of the children do not have any symptom. That's the main cause of underestimation or underdiagnosis. Whether treated or not, may persist for more than 1 year after acute babesial illness. No evidence of long-term complications, and transmit the infection when they donate the blood. Blood transfusion is the common cause, mode of transmission from humans to humans. So the infection stays in the body for about more than 1 year, so it's a long time. During that time, if they transfuse or donate the blood, they can transfer the infection to the recipient. So donor can transmit the infection to the recipient through the blood transfusion. So whether treated or not, because it's asymptomatic, maybe it missed or not treated, may persist for up to 1 year. No evidence of long-term complications, and they spread through the blood transfusion. Next, mild to moderate illness of Babesia microti. Incubation period is 1 to 4 weeks after tick bite. So once the bite of the tick occur, the incubation period is the time from the bite to the appearance of the symptoms. So it takes about 1 to 4 weeks. 1 to 9 weeks, as long as 6 months after transfusion of blood products. So the incubation period, the period by the time the symptoms appear or the illness shows up, it's less after the tick bite, 1 to 4 weeks, but after the transfusion of the blood products, usually it's about 1 to 9 weeks or up to 6 months. It takes longer after the transfusion. Symptoms typically last 1 to 2 weeks. Fatigue may persist for several months. So specific symptoms, which will be we discuss later on, what are those symptoms? They persist for about 1 to 2 weeks, but the feeling of tiredness, fatigue, malaise, it lasts longer for several months. Symptoms of mild to moderate now Babesia microti illness, gradual onset of malaise, fatigue, weakness, fever about 105, so very high fever is present, chills, sweats, headache, myalgia, arthralgia, nausea, anorexia, and dry cough. So mild to moderate infection, these are some symptoms which are usually associated with other infections also. Usually they have fatigue, malaise, they have weakness, fever is also present, fever with chills is not lot of infections present with fever with chills, but this is one specific feature. Then we have sweat, headaches, myalgia, and pain in the joint is present, nausea, loss of appetite, anorexia, and there is dry cough. Less common symptoms: sore throat, photophobia. Photophobia is the fear of light. They want to stay inside, not in the light. Abdominal pain, vomiting, weight loss, shortness of breath, and depression. These are some less common symptoms. Shortness of breath, as I mentioned, is due to lysis of red blood cell, decreased supply of oxygen is present, and also besides that anemia is there. So all these factors can cause weakness and shortness of breath, and they are very common cause of all that malaise, fatigue, weakness, and there is also depression present. Physical examination in case of mild to moderate illness, fever is the salient feature. Ecchymosis and petechiae, they are present. Ecchymosis are the discoloration of the skin. There is ecchymose, bluish discoloration. Petechiae are present. Erythema migrans, rash, signify concurrent Lyme disease. So Lyme disease is a disease also caused by the tick bite. If this is associated with this concurrent Lyme disease with babesiosis, it shows erythema migrans, rash. Splenomegaly and hepatomegaly is also enlargement of the spleen and liver. Lymphadenopathy is absent. Lymph nodes are not enlarged. Rarely there is jaundice, yellowish discoloration of the skin due to increased level of the bilirubin. Slight pharyngeal erythema is also present. These are the findings on physical examination. There is hepatomegaly, splenomegaly, erythema migrans, erythema, ecchymosis, and petechiae. So all these different findings are present on the physical examination. Retinopathy with splinter hemorrhages and retinal infarcts. Next, severe infection, how the severe infection will present. We have more susceptible population is age above 50. It's more likely to present with the severe babesiosis. Neonatal prematurity, Male gender, males are more commonly affected. Individuals who have no spleen, asplenia. HIV/AIDS individual, because they have poor immunity, they are immunocompromised, so they are more likely to have severe illness. Any malignancy, the reason is again on some medicines, chemotherapy, and then they have immunocompromised also. Hemoglobinopathy is also associated with severe illness because the infection is already affecting the red blood cells, and any hemoglobinopathy can accelerate the condition or aggravate the condition. Immunosuppressive therapy, any immunosuppressive drugs which suppress the immune system can be associated with increased severe type of babesiosis. Complications of severe acute respiratory distress syndrome, very common because of destruction of red blood cell. There is shortness of breath and respiratory distress and failure. DIC, disseminated intravascular coagulation, congestive heart failure, renal failure, splenic infarct, splenic rupture, and severe anemia. Hemoglobin is less than 10 grams per liter. So these are some serious complications of the severe Babesia infection. There can be heart failure, respiratory failure, renal failure, splenic rupture, splenic infarct. So all these serious manifestations can occur. Lab prognostic factors for severe outcome: hospitalization for more than 14 days, intensive care unit stay of more than 2 days, and death can occur if there is an elevated alkaline phosphatase level of more than 125 and there is parasitemia of more than 4%. So even death can occur if there is severe illness when the alkaline phosphatase level is high, when there is parasitemia, parasites spread to the bloodstream, it becomes systemic involvement that can also cause death. So it's a serious illness when it is associated with severe infection. Now, other Babesia infections besides the Babesia microti, we have Babesia duncani infection, range in severity from asymptomatic to fatal illness. So these even rare cases can occur as a result of Babesia duncani. Still, it can cause asymptomatic to severe illness. You can see in the red blood cells the infection. Then the clinical manifestation similar as Babesia microti infection. Next, Babesia divergence infection. These are all the pictures of the red blood cell during their reproduction, and their number is increasing. Occurred in people lacking spleen. So this infection is mainly in the individuals who are asplenic. Incubation period is 1 to 3 weeks. Symptoms appear suddenly, consist of fever, very high grade fever, almost 106. 41 degrees Celsius, more than 105.8 degree Fahrenheit, shaking chills, drenching sweats, headache, myalgia, and lumbar and abdominal pain. So all these are serious infection symptoms which occur as a result of divergence infection, and symptoms usually appear very suddenly. Hemoglobinuria and jaundice. Hemoglobin in the urine and jaundice is mainly because of the lysis of the red blood cells. Mild hepatomegaly, the liver is enlarged. If not treated, pulmonary edema and renal failure can occur. So that was all about section 2, in which we talked in detail about all the different species of Babesia, especially Babesia microti, how they present with no symptoms, then mild, moderate, and severe symptoms. And severe illness is a serious illness, can even cause death if there is parasitemia and there is elevated level of alkaline phosphatase about 125 units per liter. So that concludes our section 2. Thank you for watching sqadia.com.